Hi, my name is Christine Austin, and I've been with Step by Step for 8 years now. What I'm going to talk about today is decreasing problem behavior using an FBA, but talking about the individual assessment components. So our objectives today are going to be the objectives are going to be to identify the need for a behavior reduction plan and construct a behavioral definition. In addition, I will show you how to complete functional behavioral assessments, including the indirect and direct assessments, and also the functional analysis. And then at the end of the presentation, I'm going to help you identify various reinforcing variables that maintain challenging behavior and how to successfully implement neutral redirection. So I will go through identifying the different variables that maintain behavior, and then just talk about the very first behavioral intervention that you do want to apply, which is neutral redirection. So it is very important to identify what is maintaining the problem behavior to move into the construction of a behavior support plan, but I want to show you what to do in the meantime while you are gathering all of your information. So the first question is, what is a problem behavior? Behavioral excesses are socially significant. They affect others and the surrounding environment. They're typically of sufficient intensity or frequency that the safety of the person engaging in the behavior or others around is threatened. So when we're looking at challenging behavior, we first look at what is most detrimental to the child and the people and the environment around that child. So the most obvious that you can probably think about is aggression or self-injury, because it does result in injury to other people or to the child, and we're looking at health issues. But we also want to look at some of the other problem behavior that hinder the ability of the person or others to acquire new skills. So as we're analyzing what it is that we want to tackle first, we want to look at what is impeding the child's learning opportunities and also socialization opportunities for him or her. But it's also important to look at what leads to restrictive living arrangements. So if the child engages in aggression or self-injury, that's obviously going to warrant the need for behavioral support from another person or a more restricted environment. But then we also want to look at some of the other problem behaviors, such as non-compliance or tantrum behavior, and there's many other topographies out there, but just identifying what hinders the child from either learning or being in a least restrictive environment. So I know that many of you are probably familiar with the ABCs of behavior, but I do want to review this just quickly for anyone out there who may not be familiar with some of the terminology. Here you see the ABCs of behavior, and I've bolded the first letter because you can see the antecedent, or the A is for the antecedent, the B is for the behavior, and the C is for the consequence. And you can see that both of the arrows go directly toward the behavior because both the antecedent and the consequence affect the future frequency of behavior. So just to analyze this a little bit further, we have the behavior, that's the target behavior of interest. So whenever the behavior occurs, we want to analyze what happened right before and what happened right after the problem behavior. So the antecedent is just what happened right before the behavior, what happened immediately before the behavior occurred, and then the consequence is what happens immediately following the behavior. As you can see here in the blue, we're also going to talk about motivation. And as you hear me talk throughout the presentation, I'm going to talk about motivating variables or setting events or some of the other variables that are maybe not able to observed right before the behavior. And these are things that happen well before the behavior, but still affect the frequency of that behavior. So some of the examples that I have would be how well the child sleeps, eating patterns, maybe his mood that day, or maybe he has indigestion problems. These are all factors that affect our behavior but don't happen immediately before the behavior. So we'll talk about later on through the presentation how to assess for the antecedent and consequences, and then also how to gather information about the child's motivation.